Hi, everyone. My name is Chris Lehman, and thank you for joining us for this Heal Mind, Body, and Soul presentation. We'd love for you to join our group and continue to see interviews like this one today. Today, I'm joined by Paola Dziwetzki. She is an alternate healthcare provider that switched her attention to ozone therapy after an amazing story in which she'll share with us today. Now, Paola runs her own website specifically for ozone therapy called thepowerofozone.com. She works individually with clients as an ozone consultant and is highly respected in her field of work. So I'm excited to bring in Paola today, and she's joining us all the way live from Germany. Paola, how are you today?
I'm pretty good. Hi, Chris. Thank you for having me.
For sure, for sure. So we're excited. We're going to go over a lot. My specialty is fluoroquinolone toxicity. Your specialty is ozone therapy, obviously, and I'm excited to pick your brain. But we're going to go over everything for you guys today of how it works, how to set up your own, and so much more. And I think a lot of people who suffer from fluoroquinolone toxicity or from certain viral infections or, different things they want to know how to prepare and how to set up their own ozone therapy. And I think this is going to be a great conversation to have because all of the knowledge that you're going to bring to the table. So that being said, I'd like to jump right into your story and how you got, because I think it's such a cool story of how you got into ozone therapy. What was it, 13 years ago?
Yes. Yeah, around 13 years ago. Yeah. Yes, so it was, I was basically just randomly looking on stuff online, and I remember it was, I was reading on something on WashingtonPost.com, and there was like on the right side, there were like ads, like one-line ads, and one of them read something like completely ridiculous, something like cure cancer for $2. And I was like, this is completely ridiculous, but let's just click on it. Why not? And I clicked on it, and a text appeared, and it started telling me about the wonders of hydrogen peroxide. And hydrogen peroxide, of course, like there are different kinds of hydrogen peroxide, but the most common one is a 3%. And this can be really acquired anywhere in the world at any pharmacy for like $2 plus or minus.
Sure.
So it's really something totally cheap. And so, yeah, so it started telling me about the incredible things that one apparently can do with the simple agent, the simple compounds. But I was like thinking, okay, where is the trick here? What's right? Even asked me to put in my credit cards to charge me $500, right? And then at some point it did appear they did want my credit cards for some membership or something, but it cost only $50. But at that point I thought, you know what? I actually don't need any membership because they actually gave away most of the information. And so I looked up the name of the guy who was running this membership type of program. And this was William Douglas. He was a third generation doctor, physician. And so I looked up a book that he was selling on Amazon that was called The Medical Miracle or something like that.
Okay.
And $20. So I bought that. And I read about the wonders of hydrogen peroxide in that book, that physicians use it all over the world, that you can use it intravenously, that you can drink it in a highly diluted fashion, that you can also do hydrogen peroxide baths. And so that really spiked my curiosity. And so I ran to the next pharmacy and I bought a bottle of 35% strong hydrogen peroxide, which I could still do it back then. Now you can't, like where I live, you can't do it anymore. And I did that, and I put like 2 cups of that in a full bathtub with hot water, soaked in it for 30 minutes, as the book described. And I experienced absolute amazing things. So my arthritis that I had developed back then in my fingers, in those fingers, back then I was only 28 years old, and I already had arthritis in my fingers. So that went away after just 1 bath.
Wow.
I also developed much better stamina and I could work out at the gym much better. And then my dandruff went away, and a couple of other things improved after just one bath. And I was completely hooked on this stuff, right? And so I thought, wow, hydrogen peroxide, I love it. I want it. I want to keep doing this. This is awesome. But in that book, he said, as great as hydrogen peroxide is, there is something that's even better than hydrogen peroxide, and that's ozone therapy. And I was like, I couldn't believe it. I'm like, wait, hold on a minute. There's something.
I gotta try this.
Peroxide. I was like, what, ozone? What is this? And I had no idea, but I thought, whatever this is, I gotta have it. And then I bought those very simple ozone generators that essentially run on air that you can buy for like 50 or 80 bucks online, and that you can ozonate water with, or you can ozonate your veggies with those machines. And so I started drinking that ozonated water, and I loved it. But I thought, I need to have the real thing at some point. And then it took another 2 or 3 years, and by then I was already living in the United States. And so I bought my ozone generator that was running on pure oxygen, and I started with all the insufflations, and then later on moved to injections, and the rest is history, so to say.
Yeah, and I'm excited to jump into all that. I definitely went on your website, powerofozone.com, and saw all the multitudes of ways to administer ozone. So it's highly fascinating, in the different things that we can help with ozone therapy. So if you don't mind, how does ozone therapy work, and what conditions or what treatments is it good for?
So how does ozone therapy work? Well, there's several ways to look at it. And so one way to look at it is to look like all the biochemical things that happen in the body when ozone therapy is applied. And so we know a few things about this, what happens, but I actually don't like to concentrate on this aspect too much, because this kind of mechanistic way on looking at certain blood markers can be very misleading and can actually lead to the wrong conclusions about how something works. But what we do know is that when ozone therapy is introduced into the human body, when ozone is introduced into the human body, what happens is there is a very transient, so a very quick spike in certain reactive oxygen species, like for example hydrogen peroxide, like for example also it's assumed that hydroxyl, which is another oxygen-based free radical, spikes, that lipid oxidation products are increased. Lipid oxidation products are basically they happen when fatty acids are bound to ozone. Then also a number of cytokines can increase, but also a number of, at the same time, a number of antioxidants. So for example, like catalase or superoxide dismutase, and a number of other molecules are increased. But as I said, like I don't like to focus my view on those blood markers, because, as I said, this can be very confusing, and we see this, for example, in when we look at cholesterol levels, or for example, like things like arachidonic acid in meat. And so when one looks just at certain compounds, then this can be very confusing and lead people to the wrong conclusions. So, but what we do know, what ozone therapy does, is that it's anti-inflammatory. So ozone therapy appears to be one of the most anti-inflammatory therapies there are. This is why it is extremely effective for any type of arthritic joint pain. So one of the most effective, one of the most successful applications in ozone therapy are the so-called pro-ozone injections. So you inject ozone straight into the joint, the affected joint, and this works really well with any type of inflammatory joint pain. So this is my opinion. This is one of the most important ways how ozone therapy works. But what we also know is that it improves blood circulation. It also improves oxygen utilization. And it also boosts the immune system. Well, it's more like an immune system modulator. So when the immune system is overactive, it can actually dampen it. And when the immune system is not active enough, then it can boost the immune system. And something similar, it appears, can also happen with hormone production. So it can also boost hormone production, or if there are too many hormones, it can also dampen them.
That's amazing. And you know, I was actually taking some notes from what you were saying, and you know, you brought up, and I know you don't like to get too much into this, but catalase and superoxide osmosis, which if you're suffering from fluoroquinolone toxicity, are two things that are very, very important for your body. And then, you know, just going into, you know, as far as the immune system in general, I mean, this is so many people nowadays suffer from toxins, right? And so we know that toxins weaken the immune system. And so are you saying that this will actually, you know, boost the immune system where you can maybe then start, and I know this is a different subject, but you can start getting some of those toxins removed from your body then?
Right. So I don't know whether this is based on the immune system function of ozone therapy, but it's definitely true that ozone therapy is a huge detoxifier. So yes, it can definitely help your body detoxify a whole range of toxins.
Sure.
So
So what conditions, I know that, I know another thing too, you had talked about collagen production and, you know, connective tissue and things of that sort, but what other conditions does ozone therapy help treat? I know MS is one, and different autoimmune disease. If you could talk about that, please, and just let everybody know, you know, the power of ozone.
so because ozone is such a strong anti-inflammatory agent, so essentially every chronic condition, every pathology that has to do with inflammation, so be it inflammation of the joints, so arthritis, so it can deal with this. But there's also reason to believe that it can actually help with arthrose. So this is when there's the collagen in the joint has actually is already gone and is destroyed. So there's apparently some evidence that shows that ozone injections can actually help regenerate the cartilage, which is really amazing, because the conventional view in school medicine is that cartilage cannot be regenerated, that once it's gone for good. And yet there are some X-ray images by doctors with pre and post ozone injections where they show the same joint, and you can see that there actually is a cartilage regeneration must have taken place. So yes, but back to the inflammatory conditions. So yeah, arthritis, but also things like, for example, multiple sclerosis. This is also inflammation that is going on in the brain. But also any type of skin condition like lupus or neurodermatitis, or also psoriasis. Now, of course, psoriasis, it can show itself through skin symptoms, but also the joints can be affected in psoriasis. But also things like, for example, Hashimoto's. Those are just a few examples. But chronic fatigue, fibromyalgia, those are other examples where ozone therapy can be very effective. And of course, any type of infection. So really, with infections, you know, right now, there's this one infection I won't mention because the thought police is out there.
I was going to ask you about that next.
But yeah, with infections, any type of flu-like infections, I have personally seen absolutely amazing results. So one thing that I talked about in one of my videos is how well it worked on my dad. Because when my dad, there was a period of 1.5 years that started in around 2015 2015, where my dad worked in China. And so the way it worked is that he would fly to China and stay there for like a month and then fly back for 2 weeks.
Okay.
And then he would come back with a flu or a cold or acute bronchitis or some type of infection on top of bronchitis, on top of the COPD that he was suffering from. And so what we would do, I would put him in the ozone sauna. I would give him the ozonated oil to breathe, and that would prep him up every single time.
That's amazing.
Every single time. It was repeated. We repeated this, I don't know, six, 7, 8 times, and it worked.
Wow.
And another interesting thing, that in all that time, I never got infected by him.
Really?
Which is, for me, is really amazing, because before I started doing ozones, like 14, 15 years ago, I would get constantly sick. Like I would, like every year, I would come down with a flu or a cold or something, like 3 or 4 times a year, right? So the winter season was just like one big cold for me, like one big infection. And it was just like, after 2 weeks, I seemed to get a little better. And then I seemed to get hit again with some other infection.
Yeah.
It was a whole nightmare. And now I as good as never get sick. I as good as never catch a flu.
That's amazing. That is great. And so, I know you touched on it a little bit, and I don't know how deep you want to get into it, but, as far as things like maybe Epstein-Barr virus, or, COVID-19, like have you seen productivity from ozone to treat these certain viruses?
Right. So Epstein-Barr virus. So first of all, there is very little research of good quality when it comes to ozone therapy and infectious diseases. But from the anecdotal reports that I'm hearing from people and things that I've experienced on myself, I do think that ozone therapy is extremely effective with any type of a viral infection, much more so than with bacterial infections. With bacterial infections as well, but I think that viral infections can be very, very easy to take care of those. And I think Epstein-Barr virus can be one of those infections that can be easily taken care of. The same with shingles or herpes zoster. This is herpes zoster as shingles. This can be also relatively easily treated with ozone therapy. Now, as to the thing that you mentioned, I don't want to repeat it because the algorithms are going to get us.
Come on, it's my goal to get you in some kind of trouble during the interview.
It's your goal? Well then. As far as COVID-19 is concerned, so again, there is no solid research right now. There are a number of clinical studies that are actually underway. There are a few in Spain and in Italy and even in Iran and China that some have been concluded. So hopefully we're going to get some printed studies, some official research on that. But there are 15 different hospitals in Italy which actually officially treated COVID-19 patients with ozone therapy. And the Italian Ozone Society, they have reported some really, really promising and really encouraging results. So yes, it appears that that COVID-19 can be, I'm not saying it's a cure,
Yep.
but it appears that it can be very effective. Yeah.
Oh, thank you for breaking, everything that ozone can help with. It's very important. And I know a lot of people watching this are probably wanting to take the leap into ozone and don't know exactly how. So if we can talk about the different types of ozone therapy. I know that I had spoken to you where I just had it through my ears. I had it IV wise through a UV light. There's different things like you mentioned, a sauna. There's olive oil and different water-based ozones. And so I guess I'll turn this over to you. And if you can explain I know you can't cover every single thing that this will treat, but what type would be most effective for maybe a body-wide pain compared to, sinus infections and different things that you've explained?
Right. So this is one thing to know, to understand about ozone therapy, that it can be applied in many different ways. And when people start looking into it, it can be a little overwhelming because you can apply it intravenously, so you can go to your doctor and get it done, or you can even go to an ozone retreat for a whole month and stay there and get ozone treatments every day for like a month or two, or you can buy your own ozone equipment and do it at home. Or you can do a combination of those things. Now, generally, what I recommend that people do is to first go to an ozone doctor for like a treatment or two, and just so that you have an idea of, for example, first of all, how it works and whether it works at all for you, because ozone therapy, like with everything else, it works on some people and others it doesn't. So before you go ahead and buy your own setup for your home, I think it does make sense to first try it out at a doctor's office. And if you get a positive response from whatever ozone application you choose to get at your doctor's, then the chances that you will also get a positive response from doing ozone insufflations or ozone saunas or less invasive treatments at home is very, very high. So this is one way to do it. Another good way to kind of test whether ozone therapy is something that makes sense for you is to do a hydrogen peroxide bath. Because basically hydrogen peroxide works very, very similarly to how ozone works. But hydrogen peroxide is, of course, much cheaper. So you can buy like a pint or a gallon of hydrogen peroxide. A pint, I think you can buy for $20. A gallon you can buy for $50. And you can do a bath with that. And if you feel that this gives you benefit, if this improves your energy, if this improves your joint pain, or it gets rid of your brain fog or helps you a little bit with your brain fog, then it shows you that oxidative treatments are most likely the way to go. And then it makes sense to buy your own equipment. And at home, the home ozone treatments differ from what you get at your doctor's, in that at your doctor's, what you usually get are things like TENPES or ozonated saline IVs or DAV treatments or injections into your knees. So those are all invasive treatments, and that a needle is involved. So either your vein is being punctured or your skin or your joint. And whereas the treatments that you do at home, you can also do some invasive treatments, but usually the treatments that people do at home are non-invasive. So they do ear insufflations or rectal insufflations, vaginal insufflations, they drink ozonated water, or they do ozone saunas, or put their body in a bag where ozone is insufflated at the same time. So basically, the insufflations means that you put the gas, the ozone gas, into a bodily cavity. And so when you're thinking about doing something systemically, like when you think that that you have, from what you told me, it's assumed that the damage that is caused by fluoroquinolones is also a type of inflammation that is triggered, a systemic inflammation, right?
Yes, so, amongst many other things. Yes, correct.
Right. So in that case, if you want to do something systemically, in my opinion, one of the best non-invasive ways to treat the body with ozone systemically at home is to do an ozone sauna. I think this is a very undervalued treatment, and in my opinion, this is really one of the most effective, one of the strongest treatments. In my opinion, it can be even stronger and more effective than certain intravenous ozone treatments.
Oh, wow.
So this is a great way. But also hydrogen peroxide baths, so if someone does not want to buy the whole ozone equipment right away, just do what I did right at the beginning, just take a few cups of hydrogen peroxide in the bathtub and soak in the bathtub. So yeah, so you can do this. You can also, okay, so some people have problems with heat. Some people have a heat sensitivity, so they get really sick when they get into a sauna. If that's the case, then you can do the second best thing, which is to do an ozone body bag treatment. So this is basically, you get into a whole body bag, that's what it is. But there is no heat, so there's no steam coming in or no infrared heat. So it's just the heat of your body that is being trapped in that bag. And at the same time, ozone is coming in through a hole in the bag. So this is an alternative to ozone saunas. But I also think that drinking ozonated water can be quite a powerful treatment, even a systemic treatment, just to ozonate some water and drink it. So.
Oh, no, I love it. And I was going to ask you to get into how, we're going to talk about how to set this up. But as far as your advice to go see a doctor the first couple times or try it out before you get your own, I think that's wonderful advice. Some people jump right into the 10 pass, and then if maybe they don't react well to it, so that's what I did. I started off slow and now I'm excited to talk to you to try to, start my own at home. But I highly recommend that, especially if you do have fluoroquinolone toxicity or something else that has raised your oxidative stress, to try ozone out first to see how your body's going to react to that. I reacted very well, luckily. I mixed ozone with, which is another topic I love to get your information about. But I mixed it with PEMF, and I also had vitamin C in my first IV bag. And I know that is kind of a topic that some people agree with and some don't. So I'd love to get your opinion on that. Is mixing vitamin C while having, your ozone therapy, whether it's, if it's infused into you. Could you just explain that? Is that good to do, or is vitamin C not good to mix with ozone?
Well, so this is kind of a controversial topic in the ozone world, let's say, and there are two very passionate camps. Vitamin C. One camp says that no, you can absolutely mix that too, because intravenous vitamin C, this is a pro-oxidant, and ozone therapy is also oxidative, so this just matches like perfectly. There's no problem, no problem at all. And the other camp says, well, no, actually vitamin C is, yes, it is a pro-oxidant, but it is also an antioxidant. And it is actually used by doctors to counteract an overdose in ozone therapy. All right, so, and I'm actually in that second camp. So I tend to recommend that people space those two things apart by a few hours in order to really maximize the effect of both treatments. Now,
Okay.
if them together, so let's say if you go to a doctor and he will give you vitamin C like within 15 or 20 minutes after you received an ozone IV, or even mixes those two in a bag, which is possible, I guess, then you can do it. It won't do any damage to you, but in my opinion, you will simply not get the most out of those treatments, because you have to assume that when you mix that antioxidant, the vitamin C, with the ozone, then one will cancel out the other to some degree.
Okay.
Still, most likely get benefits. And the reason is because we know that people who only do vitamin C, that they also, many of them get tremendous benefits, right? I mean, vitamin C in high dosages intravenously, it has been shown to be very effective with sepsis, with infections, boosting immune system, and many other things, even cancer, right?
Yep.
So vitamin C alone can be extremely effective, right? So yeah, it is possible that you will receive both of them and you will see great effect, but still there will be a cancellation of vitamin C and the ozone. That's why I recommend to space them apart by a few hours, at least 2 to 3 hours. If you can do it in a way that you will, for example, receive ozone therapy in the morning and then vitamin C, let's say somewhere in the afternoon, this is even better, maybe to alternate it. So do one day ozone therapy, and the next day vitamin C, and the next day ozone therapy, the next day vitamin C, something like that.
Okay, and so things like glutathione and other IVs that you may get, same thing. Then you want to kind of space those out as well.
Now, I'm very critical about glutathione. Now, I've never received a single glutathione IV in my life, but I've talked to so many people in the mercury and heavy metal detox community who have received glutathione IVs, and many of them have really experienced absolute horrendous side effects from debilitating nerve pain, from crushing fatigue. And there's also one sentence that I keep on hearing over and over again, that I felt like dying after receiving the glutathione IV. So I tend to be very cautious about this. But I also understand that there are many people who have had glutathione IVs and who love them, who swear by them, who say that their symptoms have greatly improved and whatnot. But I just prefer that people are just well informed and are aware that it can go either way. So it can be a great experience, or it can be really a pretty horrific experience. But as combining ozone therapy with glutathione IV, doesn't make any sense, in my opinion.
Okay.
Again, if you absolutely want to do them, again, I would space them apart by several hours, 4, 5, 6 hours.
I'm with you. We could do a whole show, I'm sure, on glutathione and vitamin C. And so, but we'll stay on topic here. Okay, so someone does the first couple of treatments, they have a good reaction to it. Now they want to set it up at home, and obviously they can consult with you, and you can definitely help them. And I encourage you, anybody watching this, to reach out to Paula. And but as far as what we would need at home, as far as a generator, to create your own water, to do the sauna. I know these are different topics, but what type of things does someone need to set this up?
Right, so it really depends what types of treatments one wants to do. And this is also, so you really should match the type of ozone treatment with what you're treating. So if you're treating fluoroquinolone toxicity, so something systemic, so let's say you want to do ozone saunas or drink ozonated water, and let's say do the insufflations, then yeah, you need, first of all, you need an oxygen source, and you can pick either between an oxygen tank and an oxygen concentrator. And there are pros and cons to both types of oxygen sources. I have both types. I have tanks and concentrators, but I prefer an oxygen concentrator for everything that is not invasive. So for everything that does not include an injection, then I use the oxygen concentrator. Because the oxygen concentrator makes you independent from refills. You will never run out of the oxygen. You just need a power supply, and off you go. But I recognize that I am an exception, and the majority of people prefer to use an oxygen tank, which is perfectly fine. And so, but with oxygen tanks, there are different options. There's industrial oxygen, there's medical oxygen, there's scientific grade oxygen. But for most non-invasive treatments, so if you're not planning on doing any injections, industrial oxygen should be fine. And this you can get at most welding shops, at Airgas, or similar shops. So just get an industrial bottle. A common size is 20 cubic feet. This can last you, even if you do ozone treatments, let's say every day, if you do several different ozone treatments every day, with a 20 cubic feet tank, this probably will last you anything between 1 to 2 months, probably longer. And then if you want to refill it, then it will cost you anything between $10 and $30. So it's really cheap. But for that oxygen tank, you also need a regulator. So the regulator goes on top of the valve of the oxygen tank and needs to be a low flow regulator. So this produces flows between 1/32 meter per minute to then 1/16, 1/8, 1/4, 1.5 liter per minute. So those are very low flows. And yeah, so this is the most important thing, the oxygen, because you will get no ozone without oxygen. So once you have the oxygen source sorted out, then you move on to the ozone generator, and there you have many different options. There are 3 main manufacturers of ozone generators in the United States. That's Promolife, Simply O3, and Longevity, and they have different ozone models of ozone generators, and really you can use all of them. You can. I really tell people to mostly look at their budget.
Sure. Yep.
Whatever fits your budget, just go mostly according to this. But my preferred ozone generator, I can actually show you.
That'd be great.
This is the Promolife dual cell. And so you see here it has the different ozone concentrations and the different settings. So the way ozone generators work is that basically here on this side, it tells you the oxygen flow that you're gonna set on the oxygen tank. And then according to what type of ozone concentration you want, okay? So let's say you want a concentration here of, 26, right? 26 micrograms per milliliter. That means that you have to put the first ozone cell on a 5, okay?
Okay.
And all those different variations in ozone concentration. So I haven't counted recently, but I think I have 5 or 6 different ozone generators. One of them is a medical grade ozone generator for the Tempest that costs 10,000 euros new. It sits right there. But really, when I need some ozone, I don't go for the 10,000 euro machine. I use this one.
So could you explain that just a little bit more? So you said you had it on 26 as the setting. What does that exactly mean?
Right, so 26, this is the ozone concentration. So ozone concentration is, the units of ozone concentrations are micrograms per milliliter, or also commonly called gamma, okay? So people say, for example, okay, if, I'm using 40 gamma, so if you want to do rectal insufflations at 40 gamma, so you can set the oxygen flow at 1/8 of a liter per minute, right? And then you go up here and it tells you what number to set the dial at, and it's a 4, all right? So I would set it at a 4, and then that machine would give me a concentration, ozone concentration of 40.
I love that, how it breaks it down for you.
Yeah, well, exactly. This is perfect. It's printed right on top here. It's really great. So ozone therapy in general, ozone therapy is defined as using ozone concentrations between 20 and 80 micrograms per milliliter. So if you go above that, you are entering a realm which really does not belong to ozone therapy. So if you use higher ozone concentrations, it's not really ozone therapy, right? If you go below 20, there are exceptions, but usually if you go below 20, this is also, you're like on a threshold of effectiveness. And if you go above 80, then it can get pretty dangerous. So that's not really ozone therapy.
So I'm assuming most people start out around the 20 and then they kind of work their way up.
Yes, you can do it this way, like with certain ozone administrations, certain ozone treatments. For example, with ear insufflations, it makes sense to start very low in the ozone concentration, and also with very short time intervals. So do the ear insufflations for like maybe just like 30 seconds or 2 minutes, and just 3 times a week at a very low concentration of like 15 or 20. And then everything goes fine, then you can slowly increase until you reach, let's say, 20 minutes per day with the insufflations.
Gotcha. Okay. Perfect. So you need the oxygen tank or the generator. You need the machine, a machine like that that you have in your hand, and then what else would you need?
Right, and then depending on what you want to do. So, for example, let's say you want to do an ozone sauna, then you need an ozone. You need a sauna tent. Now, for ozone saunas, the particular thing is that you should not breathe ozone in. So, when you want to do ozone saunas, you use a foldable sauna tent where your head sticks out, and this makes sure that you don't breathe the ozone in. So only the skin from your neck down is exposed to the ozone. Your head remains not exposed to the ozone. So you can, for this, you can buy a simple foldable sauna on Amazon for like $100 or less. And there are steams. I prefer steam saunas, but there are also infrared saunas, which can be used for that purpose. I've never used infrared saunas with ozone, but you can absolutely do this. So this is when you use an ozone sauna. Now, if you want to do insufflations, it depends what type of insufflations you want to do. If you want to do ear insufflations, then you're going to use ear scopes. I'm just looking whether I have them somewhere close by. Hold on a second, let me grab them.
Yeah, no problem.
Okay, I just realized I should have prepared all this stuff to.
No.
Okay, so this is, for example, those are so-called modified ear scopes. So here you see this is just some silicone tubing. So silicone is material that is ozone resistant, and this is then attached to a trap. So this is basically a flask, an empty flask that muzzles the noise of the ozone generator, because if you attach this to the generator and you put the ear scopes on, then it will magnify the sounds, the noise of the generator. So
Okay.
you want to put a trap in between to basically lower the noise of the generator. And then the gas flows through here, through the ear scopes and right into your ears. And then the idea is that it will penetrate basically your eardrum and your eustachian tubes. And then it can also saturate your sinuses and maybe even your brain.
That's amazing. That's amazing. So thank you for explaining all that and showing us, and something that you said, and this is what I'd like to touch on next, is the safety of ozone. I know that's a big concern for people. Breathing it in I saw on your own website, your experiences with it. And so, when setting this up, make sure we're very, very careful. And how would you explain to the viewer not to make sure that they don't breathe this in, if they're setting it up at home, what guidelines and safety guidelines would they follow?
Right. So for all the non-invasive treatments, they're really extremely safe. The only danger that is really a concern is that you will accidentally breathe the ozone in, and you should really take some precautions that this will not happen, that you will really minimize it to an absolute degree. And so one of my favorite things how to do this is, again, is a mask. I know what a mask is. Okay, I disassembled it so I can show it. So it's a mask. This is my favorite gadget. So it's a mask that filters out the ozone. We can maybe include links afterwards to all the different.
That would be great.
Although I think now in post-COVID world, the masks are a little difficult to get by from what I understand. But if you can get it, in my opinion, this is the most convenient way. You just put on the mask and it filters out the ozone. If you can't get the mask, or if you don't like the mask, what you should do, you should definitely open the windows. If you have a fan going on your ceiling, turn on the fan. If you have a balcony, open the balcony. If you can set up your ozone equipment on the balcony, great, then do this. This is ideal situation. then you have ventilation all over, right? If another option that one can do is one can just buy a fan and put the fan in front of you, so the fan will just blow the ozone away from your face, so you won't breathe it. If you're in a sauna, ozone sauna, then also put a towel around your neck so that this will prevent the ozone from escaping through the neck hole. So this is definitely something that people should be aware of. So one should definitely make sure there's enough ventilation, or use a fan, or use a mask, or a towel, or a combination of those things.
That's great. And I think the safetiness of this is what kind of sometimes prevents people from wanting to jump into ozone therapy. I know when I first joined your Facebook group, I was like, oh, this is a lot of information. How do I make sure that I'm safe? So thank you for explaining that. And then as far as different, I know when I went for my first trip to getting ozone, we were going to do the sauna, and then he said that was broken and wanted to do it rectally. That I did not do, but I'm kind of wondering, as far as the safetiness and the effectiveness of that, as far as rectal through ears or through IV, I understand what you're saying, that each condition you need to figure out what's best for you. But if you were saying someone's just suffering from chronic pain in general, they come see you, what would your recommendation be for what type of ozone that they would get?
So for chronic pain like all over the body, so just systemic pain, I would, one of the first things I would probably recommend a diet change if there is a need. If I would first look at the diet of the person and see if there is way to improve it. So cut out carbs, sugars, cut out gluten, and just put the person either on a low carb or a zero carb diet. This is what I would recommend first thing, because I think this is it's one of the most effective ways to combat inflammation, and pain often has to do with inflammation. But as far as ozone goes, systemic, in my opinion, systemic and non-invasive, ozone saunas, ozone body bag, drinking ozonated water. If they want to do intravenous, then go to a doctor and get any type of intravenous ozone treatments, 10-pass, major autochemotherapy, ozonated saline IVs, DIV ozone treatments. If they want to learn those for themselves, some people are adventurous enough that they want to learn them and think they can, then they can contact me and we can talk about it. But as far as systemic treatments, those are the ones that I would go for. When it comes to rectal insufflations, now I'm also, when it comes to the ozone world, I'm a contrarian on this. I do not think that rectal insufflations are a potent systemic treatment. This is something that is widely believed and widely promoted in the ozone world. I do not agree with this. This is an idea that is mostly, in my opinion, this is mostly kept alive by sellers and manufacturers of home ozone equipment, and whose interest it is to make people believe that they can simply do some rectal insufflations at home and that they will get the same benefit as if they got an intravenous ozone treatment at a doctor's place, right?
Gotcha.
They keep this idea alive, but in my opinion, no, rectal insufflations, if you have some type of systemic condition that you're treating, in my opinion, rectal insufflations are not the thing to focus on. But having said this, I have the theory that what I have observed is that people who eat a diet which promotes inflammation, with people who eat a lot of sugars, gluten, or just eat anything and everything, who do not restrict the diet at all, I have made the observation that those people tend to have a stronger positive response to rectal insufflations.
And feel free to go in on that. I know that was actually going to be my final topic, is diet, and how diet has affected you personally. And if you would like to tell everybody, I know you're strong into the carnivore diet. And so feel free to jump into that as well. And because it's such a big part, again, touching back on the inflammation aspect, almost all disease comes from inflammation. And if you can't lower inflammation, you can't heal, you can't get out toxins, you know, you're not going to fight off infections. So yeah, talk to us more about the carnivore diet.
Yeah, so I have a connective tissue disorder. I know this for a fact, has been confirmed by doctors. And so there are a few things that, a few symptoms that I'm dealing with, probably because of this connective tissue disorder. And I've been now on the carnivore diet for over 2 years. And I have reason to believe that this has actually improved some of those issues that I attribute to the connective tissue disorder, among others, a cervical instability that I'm suffering from. Usually I actually wear a neck brace, and I actually took it off specifically for this interview because neck brace. But yes, since being on the carnivore diet, many things have improved, and also some joint pain and joint stiffness that I used to experience before I changed my diet. And I think, yes, so I think the combination between ozone therapy and carnivore diet, those are really the two most potent anti-inflammatory things, therapies, interventions that one can do. And they're both relatively safe and can really make a huge, huge impact. So yes, so I think that, you know, I believe that most people, probably 80 or 90% of people who do ozone treatments and who get benefit from those, probably would not need to do them if they were on a ketogenic or carnivore diet.
Sure.
You know?
Sure.
I really believe, because if you look into the carnivore community, and there are Facebook groups, there are Reddit groups, there are Instagram doctors who post about it, Twitter community, all sorts of communities. So there are thousands of people all over the world who eat only meat. They eat only meat and drink water. And if you look into their reports, into their experiences, and talk to them, then you see that joint pain disappears, even with people who suffer from gout, incredibly, all right? So gout, this really blows my mind, because school medicine says that if you have gout, the last thing you should do is eat meat. You should actually meat as much as possible, and yet those people start eating only meat and their gout attacks stop, okay? Then people who have multiple sclerosis, they go on a meat-only diet and their symptoms disappear. People with thyroid problems, the same. With all sorts of skin conditions, with chronic fatigue, with cognitive impairment, brain fog. You know, there's also this one doctor, an emergency room doctor who suffers from Ehlers-Danlos. There's also connective tissue disorder. And she says that for years, what she was going through, that every morning she would wake up with at least one dislocated joint. So the first hour of every day, she was spending trying to put the joint back into its place, right? And it was excruciating pain. And then she starts eating only meat, and she stops having the dislocations, right? So this shows me, okay, because Ehlers-Danlos is also a connective tissue disorder. And if you have dislocations, that means that the ligaments and tendons are just loose. There's a poor quality of that very connective tissue, the ligaments and tendons, right? Then she goes on a carnivore diet, dislocations stop. So how do you explain this? Most likely because the ligaments and tendons just got tighter, and everything just is in place, just better, right?
Yep.
This shows me that, yes, if there is a problem with connective tissue disorders, then carnivore diet or ketogenic diet can greatly help. And also, you know, because of the collagen, meat has collagen. If you have a connective tissue disorder, you want to have collagen, right? Yep. I think this is, yeah, the combination with ketogenic carnivore diet and ozone therapy, this can probably get rid of a huge number of chronic conditions. Maybe, possibly, hopefully, also fluoroquinolone toxicity.
Yeah, it's so important. And you know, we're not saying the carnivore diet's going to work for everybody or a vegetarian diet's going to work for everybody. You got to figure out what's best for you. You might have oxalate issues or protein issues, whatever that is. But if you're not feeling well, remember 70% of your immune system is in your gut. 80 over 80 almost 80% of what's going up the vagus nerve to the brain is coming from your gut and from your organs. So if you're not healing diet wise, you're not going to heal the systemic chronic issues that you have in your body. So it's very important you find the diet that fits you properly. I'm so glad that you found yours, because it's a lot of trial and error, right? And so yeah, once you find your diet, stick to it. And you know, that's what this group's about. That's what Paula's preaching here. And so thank you so much for explaining that. Any last words? Where can people find you? And if they want to, you know, come to you for a consultant, where can they contact you at?
Yeah, they can go to the powerofozone.com and then just /book me, and then they can book a consultation with me if they're interested, or just go to the powerofozone.com and go to the search function, and you know, there's information about which ozone equipment you can buy, which ozone generator, you know, starting also with the oxygen sources. I also set up a whole guide how to buy ozone equipment. So this is a huge document that is quite popular. So for everyone who is looking into buying their own equipment for home, you know, they can study this and pick the right equipment that they like. So we can maybe also include links to this underneath the video. And yeah, so, you know, I think my website is, the idea behind my website is to be a resource for all things about ozone therapy, both at home and at the doctors. So go to my website, you know, check out the information. And if you want to talk to me directly, the powerofozone.com/book me, you can book me.
That's amazing. Please check it out, powerofozone.com. It's such a clean, nicely put together website with tons of information. So Paula, thank you so much for joining us. I'll make sure to put those links where people can find you. And thank you so much again for joining us, and enjoy the rest of your day. All right.
Thank you. Thanks for having me.
Thank you so much. Again, I hope that you like this interview. For more interviews, please like us on Heal Mind, Body, and Soul Facebook group. And thank you so much for your time.